Hello, in this video, I'm going to be talking about joint pains from aromatase inhibitors and a little bit about joint pains from tamoxifen. Before I go on, I'd love to invite you to subscribe to our channel. We put new content out a couple times a week, so there's always something new to watch. When I talk with patients about the aromatase inhibitors and the side effects, the first thing I say is joint aches and pains. So this is the most common side effect and can be really troublesome. Why does it even happen in the first place? Aromatase inhibitors work by blocking the production of estrogen in the body. So even after our ovaries stop working, we still make lots of estrogen, and the aromatase inhibitors block the production of estrogen by tissues other than the ovaries. This lowers the estrogen level in your body, and that's what we believe causes the joint aches and pains. Estrogen is really functional in helping our joints feel good. So whether one goes through menopause naturally, just with time, or has already gone through menopause and is put on the aromatase inhibitors, that drop and that further drop in estrogen is what leads to joint pains. How common is this? Up to 2/3 of patients will have some discomfort or pain in their joints. What joints are we talking about? It's basically any joint in your body, including the joints in your back, but we most commonly think about ankles and wrists and hands and shoulders. But it can be any joint. So if you're on an aromatase inhibitor and you're having joint pains, it's very likely to be from the aromatase inhibitors. These side effects can start within the first week of treatment, and unlike side effects from tamoxifen, some of which go away, the joint pains from aromatase inhibitors continue. They don't get better over time. So it's important to pay attention to this side effect, see if it's manageable, and I'll be talking about some practical tips in a moment to help. If they're not manageable, you can switch to a different aromatase inhibitor or consider other options, which I won't go into today, but we have a great library of videos on endocrine therapy for breast cancer that I would encourage you to check out. So again, joint pains can begin within the first week of treatment. They persist for the most part throughout the entire time that you're on aromatase inhibitors. Switching to a different one can be really effective. We don't understand why, but it can be really helpful in decreasing the joint pains or making them go away altogether. So let's say you're on an aromatase inhibitor and you're having joint pains. What can you do about it? Well, if you've noticed the comments in our channel, the most important thing is to move. So when we think about pain, we often think, I don't want to move, this hurts too much. But surprisingly, perhaps, that movement can actually re-lubricate your joints. So doing things to use your joints, whether it's walking or doing exercises with a squeeze ball or with yoga equipment, this is one of the most important things. The other thing you'll want to do is decrease your sedentary time, the amount of time that you're inactive. You will notice, most of you, that aromatase inhibitor-associated joint pains are worst in the morning after we've been sleeping for a while. So when you get up and move around more often during the day, that will help you not experience such severe pain when you do get up. So there are lots of ways you can remember to get up once an hour. You can set a timer. If you have a smartwatch, it will often remind you to stand up. And what you want to do is move around. Now, let's say it's in the morning that they're the worst for you. You're not going to get up all night and keep your joints moving. So you wake up in the morning. What can you do first thing in the morning? You can do some yoga exercises, some stretching in bed even before you get up. You can get on all fours in your bed and do what's called cat-cow pose. We'll put a picture here so you can see what that looks like. You can do child's pose, where while your knees are still bent, you get on your stomach and stretch out. Just that movement, getting the body moving, getting your heart rate going, that can be very helpful. Other things you can do are use heat, like a heating pad in the morning before you get out of bed, or after you've been sitting for a while. There are even ways to heat something up for you when you're on a long car ride, and that can be useful. We recommend using ice after you've been working out a lot or at the end of the day. So heat in the morning, heat after you've been still for a while, ice towards the end of the day or after you've gone walking. If you have some pain or discomfort, ice can help. The other thing you can do is alternate heat or warmth and ice. So you can use heat for 10-15 minutes and ice for 10-15 minutes and go back and forth. That can be very useful for some people. Another thing you can try are warm baths, like heating pads work, or heating up something in your microwave and putting it on your joints. A warm bath can be very useful, or in the morning, a warm shower. Just getting the blood flowing to your joints is useful, whether it's through movement or topical heat. Speaking of topical, there's some things you can try on your joints. Capsaicin comes from a hot pepper, and that can heat up and relieve pain in joints as well as other parts of the body. It is very burning if you touch your eyes or other mucous membranes. You want to be really careful to wash your hands after you apply really any topical ointment. Another thing that can help is Icy Hot, which does the same thing as capsaicin. That's a brand name for a menthol-containing ointment. And there are also non-steroidal anti-inflammatory ointments you can apply, a brand name of which is Voltaren. So you can put those on your joints and you will find that that can alleviate some of your joint pain or discomfort. So there are a whole bunch of different things you can do between movement, topical heat, or topical cold. These ointments I'm talking about, building up the strength of your muscles around the joints. Lots of different things that you can do. Yoga is really, really helpful. Yoga moves will help gently increase your heart rate and blood flow to your joints. If you have other tips, drop them in the comments. What's been helpful to you? Also, if you're interested in understanding why aromatase inhibitors are being recommended in your case, I would invite you to go to yerbba.com to get your personalized report. Your Yerbba report is created by, once you give us permission, downloading all your medical records, all the tumor characteristics, and then it will give you a personalized and updated in real time report that updates your Yerbba report with information that we know about you based on different treatments you've had. It also gives you the pros and cons of each type of treatment and a chance to ask your physicians and other healthcare team members questions. So we give you prompts that will say, here's some questions you might want to ask of your medical team. So go to yerbba.com and you can sign up for your Yerbba report. There are a few dietary interventions that you may find helpful. One is omega-3 fatty acids. We get omega-3 fatty acids from fatty fish, so salmon and tuna and swordfish, if you have access to those. Another thing that you'll want to think about when you're on aromatase inhibitors is vitamin D. Many, many people are vitamin D deficient. In fact, it's recommended in the United States that we don't actually check vitamin D levels, but rather that we have people take vitamin D supplements. You can get vitamin D in fortified foods like cereals and orange juice and milk, but that's a supplement that's added naturally that's added to natural foods like milk. So it's not actually naturally occurring in food, but rather it's added. And then, of course, calcium can help your bones as well. But vitamin D and joint pains, this has been studied a lot with very mixed results. So some studies have shown that it helps, and other studies that are actually better conducted have shown that it doesn't improve joint pains over placebo, but you probably need vitamin D anyway. We've learned from some of you watching that in Scotland, everybody is advised to be on vitamin D. No checking levels, and that's because in northern climates, there's just not a lot of ability to make vitamin D from the sun. And actually, with time, we make less vitamin D with the same exposure to the sunlight that we had when we were children. So just with time, we're less efficient in making vitamin D through the skin, and supplements are probably a good idea for multiple different reasons. I promised I'd talk about tamoxifen and joint pains. Tamoxifen can cause joint pain. It's not as common as with the aromatase inhibitors, but if you've noticed joint pains while on tamoxifen, it's real. And the same things that I've told you in the preceding parts of this video will apply. So I really wanted to focus on the aromatase inhibitors, but I think it's worth mentioning that people on tamoxifen have reported joint pains, and it's a real side effect. It's not an imagination or placebo effect from tamoxifen. I've covered a lot in this video. Again, drop a comment or a question below. We get back to you just as soon as we can. We get several hundred comments every week, so we get to each of you as soon as possible. We don't actually curate comments. Sometimes YouTube might remove a comment, but we don't curate comments. We respond to absolutely everything that you send us. Thanks so much for watching, and we'll see you next time.